Well, welcome everyone. Thanks for popping on tonight to listen to this. Should be a fun one. Let's just get right to it. I do want to thank Henry Schein. Obviously, they're the ones that kind of helped put this together. And we'll be talking a lot about their composite natural elegance as we go through this. And I'll show you lots of different cases of that composite. But we're going to talk about a lot of things. And obviously, I want you to make sure that you learn something. I promise it'll be a fun course. I have lots of slides, lots of pictures. I like it to be kind of not a boring course. So you should be pretty entertained. And I guarantee you'll learn at least one thing. And that way you can apply it to your everyday practice and hopefully make your lives a little bit easier. And that's the ultimate goal. From this 1 hour webinar, I basically want you to take off your practice tomorrow or your job tomorrow, and hopefully your day is a little bit easier. You learn something that will make it easier for you. I'm from Mentor, Ohio. It's about 30 minutes east of Cleveland. I practice with my dad, my sister. That's my family. That's my oldest son, and that's my middle son right there. Just stiff arming that kid. It's pretty awesome. But what I always tell them in sports is to not fear failure, right? Things are going to happen. You're going to screw up. You're going to make mistakes. And that's the same thing with dentistry is really failure is doing the same thing twice. We've all had these things happen. We've all had fillings debond and the work we've done chip. People used to always say, if you haven't had a file separate doing a root canal, you haven't done enough root canals. Implants fail. We've been there, right? So failures happen. And so there's a lot of stuff that we deal with as dentists and a lot of challenges we face as business owners and things like that make our jobs even more complex and more stressful. So the whole purpose of this webinar that I've put together is in this series is finding ways that we can simplify what we do. And if we can simplify what we do and make things a little more quicker, ultimately it ends up being a little more profitable because we're able to do things a little more smooth. And those are the things that we'll talk about today. A lot of different techniques to help you in your everyday practice. Some of the techniques we'll talk about, obviously, dealing with posterior restorations as well as anterior restorations. And I'll show you all those different procedures that can be done with Henry Schein's composite. A few things that's going on in the world today of dentistry. I feel like there's so many things. We could spend hours talking about each one of these things, but what we'll focus on in this webinar is dealing with kind of some same-day dentistry, some same-day cosmetic makeovers, as well as some things that are quick and affordable alternative treatments for our patients, as well as doing them with some innovative techniques. So if there's anything about the world today, it's that you have so many people taking pictures of themselves, right? 20 years ago, you would take pictures of other people. Nowadays, people are taking selfies all the time. You can look at this, 25,700 selfies in his or her lifetime. So people are constantly taking selfies, and in doing so, they're constantly seeing their smile and finding things they don't like about it. I think we've all had these patients, right, where you tell them they have severe periodontal disease and they just want to do whitening, right? People want their white straight teeth. And if you can't provide it for them, they're going to look for ways to find straight white teeth themselves, right? It's kind of funny. Things people are finding online, people are doing. But the smile is an important feature of the face. Actually, the ADA did a study saying that a person's smile outranked their eyes, hair, and their body as the most important physical feature of the face or the body. And our work is so important that for most of you, you probably noticed that this guy's missing a lateral, right? That's the first thing you looked at. And the second thing you may have noticed is that he's missing an eyebrow, or maybe you haven't even noticed yet. But when people look at people's faces, the first thing they notice are their teeth, not the fact that he's missing an eyebrow, right? So some of the things that we do is the most important parts of the face. We're lucky that we're able to do something so important, right? That we're dentists, we're working with the most important physical feature of somebody's whole body. And so when you're doing a little filling, a little chip, things like that, it may seem kind of mundane and stupid, but these are the most important physical features of the body, the smile. So let's simplify some of the stuff, right? So first thing we'll get into is cosmetic bonding and some ways to simplify cosmetic bonding. Obviously, the con with cosmetic bonding is that it's very technique sensitive. Typically, you have to be very artistic. The time constraints with it. I was at a webinar or a CE course in Los Angeles, and I heard a dentist up there saying that he spends 90 minutes per central, which is crazy. Like, it's so much time. I take insurance, PPOs, everyday blue collar dentist. I can't bill that out to my patients. And so obviously there's a lot of things with cosmetic bonding and doing smile makeovers with cosmetic bonding that we need to simplify and make quicker, more affordable for our patients so that we can keep going on and make people happy. And so here's one technique. Obviously, you have a patient with some spacing. He doesn't want us to prep his teeth at all. So this is a perfect situation. What you'll do with him, or what I do with this guy, is you take an impression and do an alginate and send it off to the lab, or you do your own wax up and do a mock-up wax up. Once you have that wax up, what you'll do is make a clear registration of that wax up, right? So here I'm trying it in the mouth just to show the difference, but you can see that space that's in there is where the wax was mocked up. And the important thing with this is you get a good clear registration and you have a good wax up, because whatever your wax up is what's going to be in the mouth. And then take your flowable and poke some holes in that guide beforehand. And I'll poke one hole. Sometimes I'll poke two holes. Now, maybe I'll show you the video of this later. But the two holes is nice in each one because you'll fill in the one and you'll see it squirt out the other. But what you'll do, so here we are, no prepping, no numbing, nothing. Just go ahead and isolate alternate teeth. And as you etch those two teeth, you'll bond those two teeth. And then you'll stick your guide on and squirt the flowable in. And I'm showing this case just because most of the time it doesn't squirt onto the gums. It'll be real clean. But I didn't make the best guide when I did this one. And I put this one on so I can show you that if it squirts onto the gums, it's not a big deal. You just take a little high speed and go around and trim it off. And I'll show you that video. But what's nice is you don't have to use any instruments. You don't have to do any pushing the composite around or any of that. And you can get a perfect smile makeover without having to do anything. And then do the alternate teeth. And here you go. He comes out like this. This is a one appointment. Takes literally like 30 to 40, well, probably like 40 minutes to do those four. And it's one shade. That's their Natural Elegance composite. And there's no shaping, no lab bill, no prep, no pain. If you do your own wax up, that's about it. Like, you're just, no instruments, put the putty on, put your flowable, squirt it in. I'll show you the video later. We'll do some other ones. But that's an easy way to do some cosmetic bonding without having to do all the stress. Whatever your wax up look like is exactly what those teeth are going to look like. So it's kind of nice. It's an easy thing. You kind of know what you're going into without all the stress. Let's get into some more techniques to kind of simplify bonding, right? So we'll talk about the Optrasculpt, talk about some U-veneer, some BioClear, and some black triangles. And we'll get into posterior stuff too. But let's start out with diastemas, right? So you get some spacing. If it wants to go down here, if we're frozen, what's going on? There we go. All right, so this one I'm going to use a BioClear on to close the diastema with, but here you go, same thing, just composite. I'll use flowable and composite together. I'll show you that. And in 20-30 minutes, no prep, you're able to get a really nice diastema closure with those BioClear matrices. And see these curved matrices? You can tuck them in the gums like that, and they'll get a really nice contour. I'll show you a little bit more detail with the BioClear matrices later, but they're a really nice way to get a nice contour, really makes it quicker, easier, better for the gums. And obviously, I do like to polish my composites with ShapeGuard. It's a really nice polishing system through Coltene, but this is my polishing protocol. I'll just use a flame diamond, clean up the edges. I do like to use discs. I'll use a black one and a navy blue one, maybe an enhanced cup. There's the ShapeGuard. Those are autoclavable, so they last a really long time. And then, sometimes a bristle brush on top. But so let's talk about UVeneer. I'm just going to try and give you guys a lot of techniques. That way, like I said, there'll be hopefully something you can take with, but I'll give you lots of techniques on ways you can fix things up. So this is kind of a cool system. I'll show you how to do it, but what you do is, this is a case where we're not going to take anything off the teeth either. We're just kind of build them out. They're kind of flared lingual. So I'll just etch the tooth, try on a size. That's kind of the one we're going to go with. And then etch and bond and stick that thing on. And I usually like to have some flash like that on the sides. So then I can go through and kind of trim this off at the end. And in this one, we're just doing, when you do a smile makeover like this, I do like to go one at a time. I think it's better. It keeps my references. I'm able to use the other teeth as a guide. So I'll kind of do one and restore one tooth at a time. But it's a simple, easy way to kind of, again, do something cosmetically to enhance their smile, where I'm not having to spend time shaping the composite. I can just use one of those prefab forms and just stick it on. Another UVeneer case. They're really nice. You just kind of, the shape of the tooth, the line angles, all that's already pretty much determined by those forms. You just stick your composite on, stick it on, and maybe trim up a little bit around the margins, a little bit on the incisal edge. But for the most part, all that shaping and polishing and things like that's kind of taken care of, which is really nice. If there's an instrument that I think makes cosmetic bonding a lot easier, it's this. It's the OptraSculpt by Ivoclar. It has these interchangeable pads. There's a small pad and a larger pad that you can see. You just pop them in and off of that instrument. But it's really easy to push composite around with that. This is a case with just the OptraSculpt. What I'll do with these ones when they're decay, obviously clean up the cavity. And I think it's important to always have something like this, the lingual shelf and then the contact outline. And we'll get into this when we get into class 4s. But once you have the lingual shelf and the contact outline, the rest is really easy. And that's when you can just take composite, squirt it on, use the OptraSculpt, and it pushes the composite around really nice. And something like this is a quick, easy fix with Henry Schein's composite. That's what this one is. And it kind of flows in nice and all one shade, nice one color. It polishes nice, and it has a strong wear resistance. This is a cool video. I would click on this, but I never know exactly. I don't trust the sharing screen so much on Zoom that I would feel comfortable. But this is a good, just Google OptraSculpt, and you can watch this video. And what it does is it shows the OptraSculpt moving some composite around versus a metal instrument moving composite around. And it just shows how much easier and cleaner and smoother, less bubbles. So I pretty much only use Optrasculpt on anything anterior or class 5s. My dad, I practice with my dad, he uses Optrasculpt even on the posteriors, on the occlusals to push the composite around. So the Optrasculpt is a really nice instrument. If you don't have that, I think that's one tool you could add to your practice that would make your lives a lot easier too. Peg laterals, like I said, I just want to give you lots of different options. We'll get into class 1, 2, 3, 4, 5 and all the different techniques that we can talk about too. But you get a patient like this and they got a lot of spacing and peg laterals, and obviously try and go the least invasive route first. Try and give her something. We're not going to take the teeth away or do anything destructive. So in something like this, what you want to do is redistribute the space, right? So I'll show you kind of a little simple way to do that. Is step 1 would be to close this distal gap on the central, right? So you close that gap first. Because if you widen that on the lateral, then that tooth's going to get real wide. That lateral is going to get too wide. So if you distribute the space on the central and the canine, then you can make the lateral look the right size. So extend that on the central. Step 2, go ahead and build that lateral kind of so a decent proportion, and then finish the distance on the canine. And so you're able to kind of distribute that space, and that's a big space, and make it look somewhat natural with just one shade of composite. And this is all another kind of both sides showing how one shade of composite, it can go a long way. And I think composites have changed a lot in that sense, is that they have a lot better chameleon effect. I think these composites can take on a little bit of the color of the tooth, which makes it kind of blend in a lot nicer. And so something like that is an easy way to help a patient in one visit. You're able to do something minimally invasive for them that you're not extracting and doing implants. And it's kind of an easy step right now, and even less invasive than veneers or something, and less cost effective or less cost for the patient than veneers. So finding ways to use cosmetic bonding in your practice is a great option, right? It's something that you can do quick. It's something you can do same day. And these things are life-changing for patients. When you can do something quick and affordable for them, but yet enhance their smile, those are the things that patients love. Those are the things that patients talk about. Those are the things that they tell their friends about. And their friends notice and say, who's your dentist? And it's an easy way for you to build your practice. So something like doing same-day cosmetic bonding is a nice thing to add to your practice. So to go with that is our black triangles, right? My wife always complains about, I actually have to fix hers. She always says it looks like she has pepper between her centrals. So one of these times we have to do this on my wife, but you can see that little spot right there, those little black triangles, and they drive people crazy. They always think, people think they have something stuck in their teeth, like black pepper or something like that. And so, obviously, these can be a little problematic. You can see in this case, maybe somebody tried to close that gap and just kind of maybe it isn't a perfect form on the tissues. And so I'll show you an easy, simple way to fix black triangles. And that's with this BioClear kit called the Black Triangle Kit. It comes like this. I'll show you how to use it. I think it's a game changer to have in your practice. I think it makes these things super easy. But what you'll do is take the perio probe that comes with the Black Triangle Kit, and you'll stick it in the space. And there's different colors of matrices. And so what that perio probe does, or that space probe, is it gives you a color and then indicates what matrix you'll get. So that's showing yellow is the space. And so you'll grab the yellow matrix. And usually you'll do both at the same time. This one I'm kind of doing one at a time just to show, but I'll do another case where I do both matrices at the same time to close the space. But you can just see how that's tucked in under the gums, and you can see the little gap that it's going to fill in. And so what's nice with these matrices is you don't have to worry about having a ledge with a regular Mylar strip. You might have an overhang that when they floss, they'll snag on it. these are going to eliminate that. It's a real nice, it's tucked up under the gums, so you're not going to have those overhangs. When I use this technique, when I do the black triangle kit, this one I like to use injection molding on. And I'll show you different cases with that with posterior. But what injection molding is you'll etch the tooth, dry the tooth, and then what you'll do is paint your universal adhesive on, air cure it, but not light cure. Just blow air on it just to evaporate the solvent. And then I'll do a flowable and a packable, and I'll cure it all at one time. And you can see that right here. I've etched the tooth, I've bonded the tooth, and then I've put flowable in there, and I've put packable composite in there, and I've put it all in at one time, and then I've cured it once. And by curing everything all together, it just seems to get a perfect seamless match. We'll talk about that later on and how you can use heated composite with that to reduce shrinkage and to make sure you have no gaps. And we'll talk about all that later. But this is just showing how you can see that perfect little black triangle, how it's gone. Using the black triangle kit is a simple and effective way to kind of reduce that black triangle. The other thing about it is you get really good contours. And this patient's had perio surgery before, so obviously getting gum contours right is going to be important. So we'll take that piece off, and you can see once you clean it off, we're going to go ahead and use a yellow here and just go ahead and clean up those contours, and that gets tucked up under the gum. So it's a lot more friendly to the gums. You're not going to have those overhangs when they floss, which means they're probably not going to snag it and pop it off when they're flossing. Same thing, here's another small gap. I'll use the black triangle kit for these too. Here, I'll tuck the two yellow matrices in there. Like I said, I'll do injection molding this way. I won't cure anything. I'll cure the adhesive, the flowable, and the packable composite all at one time. And you can see from here to here, you get a nice transition, a nice color, but it's a nice way, and you can see how friendly it is to the gum tissues. This patient's going to floss, and he's not going to snag on an overhang from a Mylar. The black triangle kit makes things easier, makes things faster, makes things healthier for the gums, right? So it's a nice thing to add to your practice. Again, trying to give you as many techniques and things that will make things easier for you, right? All right, so we're getting into some stuff. Let's get into posteriors. So that was some anterior ways to make your lives easier. Let's get into some posterior stuff. So first of all, even anterior, posterior, it's probably important to make sure you have your adhesive protocol down, whatever bonding agent you're using, whether it's a universal, whether it's a two-step, three-step, whatever it is, just make sure you understand your adhesive and make sure you have a reproducible protocol. That's the most important part, is really making sure that you can reproduce the same protocol all the time. And that's hard if you're having different assistants all the time. Sometimes assistants will blast off the etch too early or not air cure the adhesive. This guy, just real fast, this is the guy that invented Post-it notes. And when he was trying to create Post-it notes, he actually was trying to make the world's strongest super glue. He was trying to create the world's strongest glue. And it ended up being a total failure, right? Because it ends up being like a really tacky, touchable glue. So he thinks he's failed because he was trying to create the strongest glue. And in reality, he ends up making $1 billion item in Post-it notes. It's the perfect type of glue for Post-it notes. It's perfect type of adhesive for that. And so it's something that he thought was a failure, ended up being a success, right? But with adhesives, the most important part about it is to make sure that you evaporate the solvent. If you're using a universal, it says in this study that with incomplete solvent evaporation and total etch, it basically led to poor bond strength. So if you're not evaporating that solvent, that's one of the biggest causes of poor bond strength. So make sure that you air cure that or evaporate that solvent whether it's alcohol or acetone, whatever it is, just make sure you're evaporating that solvent. And this was one study that showed that it was actually beneficial to do, it says with both adhesives up to 3 layers, especially if each layer was light cured, that you could reduce micro leakage by having increased bond strength by doing a bond, air, cure, bond, air, cure, bond, air, cure. I've also heard from different speakers sometimes that you can do bond, air, bond, air, bond, air, bond, air, then cure. But this is one study showing that maybe that's a way to obviously increase bond strength. Again, it's kind of finding whatever works best for you and reproducing that same protocol. Cleaning the surface prior to using your adhesive has been shown to be very effective as well at deactivating the MMPs. You can use a 30-second scrub with chlorhexidine. And this is obviously going to increase bond strength. And it's been proven to do that too. Over here it says it can preserve the integrity of the demineralized collagen matrix and increase the strength of the resin to dentin bond over time. And using a chlorhexidine is able to inactivate all MMPs and dent even at low concentrations. Basically, you could increase that dentin hybrid layer if you're able to deactivate those MMPs. And one technique or one brand that's out there is Concepsis. It's a nice one. You can use chlorhexidine too. I'll show you the next slide. But the whole point of that is that they do say you get less post-op sensitivity and a better bond by using it. And here, I think a protocol, whether it's with Concepsis or it's with chlorhexidine, I'll etch the tooth and then I'll scrub it with chlorhexidine for 30 seconds, or if you use Concepsis, and then I'll blot dry it, and then paint your adhesive on, and then air cure that. Make sure and the point of the air cure is to evaporate that solvent that's in the universal adhesive, and then cure. I think it's a good technique, a good protocol that will help decrease sensitivity and increase bond strength. One of the things with composites, obviously, is we've all seen those where you get voids and white rings around the composite, you get debonding, and you get sensitivity or post-op sensitivity. And those are all basically problems that happen with composite. We've all been there. I've had composites debond. I've seen failures, and I know the reason typically why is I'm probably doing this, right? I'm not taking my time to do incremental cures. I'm just squirting it all in too much, too fast, and you'll get shrinkage, right? And then you get shrinkage. That's when bad things happen with composite. Costanza, he was in the pool, right? So, okay, composite solutions. So to combat that, we'll talk about bulk fills, incremental cures, snow plow technique, injection molding, and some heated composite, and how all these techniques may be able to help us reduce that polymerization shrinkage. So heated composite, I don't know if there's a lot of people out there using composite warmers, and we'll talk about that. But I think the most important part about heating composite, and what I like about it, is you get this increase in kinetic energy, and you get all these kind of things moving around. And when you get this increase of movement, you get an increase in the degree of conversion by getting an increase in the depth of cure. So basically, all this stuff's moving around and all this stuff's heated up. The packable composite kind of starts to feel like a flowable. It kind of squirts in real nice and smooth, and it increases the depth of cure. So now you're able to get a deeper cure with a heated composite. And I'll talk about the pros and cons of heated composite, but what's important with it is that when you heat your composite, you got to make sure that you use that within 2 minutes after you've removed it from the heat source. The composite's going to lose half of it's going to lose a lot of its, it's going to cool really quick. So make sure when you take the composite, don't just take it from a composite warmer and put it on the tray and then wait 30 minutes till you're done with your numbing and prep. You want to keep that thing warm until right when you're ready to fill it. And then a minimum of 140 degrees has been shown to to be the right temperature. I kind of do mine at 150, 155. I'll show you that. But well, here's an injection molding technique. And I think that's important because, again, injection molding with a heated composite, if it's a heated composite, you can increase the depth of cure, right? And a lot of these bulk fills, and this is Henry Schein's bulk fill called Maxima, and it comes in a flowable that you can see in that syringe, and it also comes in a packable. And this, I'm going to show you how to use it all together. So what I'll do with a case like this is I'll take a little perio probe and I'll put like an endophile stopper on it, and I'll stick it in the prep or the broken tooth or whatever, just to get an idea of how deep it is. And if I stick it in there and I see I'm at like 4 millimeters or 5 millimeters, I'm not worried. I'll just do it all in one fill. With a bulk fill, the bulk fill has a good depth of cure because it's a little more transparent, so you get a good depth of cure. If it's a heated one, they say you get an increased depth of cure. And so with the reduced shrinkage, right? So what I'll do is I'll put a greater curve band on it. That's a brand that I like. The reason why is you can see on here, you'll get a real tight seal. And then I'm going to injection mold it. So I'm going to etch it. I'll selective etch the enamel. And then I'll go ahead and rinse the etch off. And then I'll paint the universal adhesive on. And then air cure your adhesive to evaporate the solvent. And then don't cure the adhesive, right? So this is all going to get cured at one time together. Then I'll use the bulk fill in this situation. I'll use Maxima with the flowable tip, squirt the flowable in, and I'll use the composite warmer for my bulk fill, and I'll squirt that in, which makes it come out like flowable even more. So now you've got all this one big mess, and I'll cure it at one time. And I'll give it a rough shape and a polish with Shape Guard. And you can see there's no voids, there's no holes. It's all one good solid cure. And so I do think that's a nice thing to add to the practice or your everyday work, is that having a bulk fill like this is nice. You're able to give them a strong restoration in a quick manner. And obviously, if it's decreasing the shrinkage, you're going to have less post-op sensitivity, less debonding. Here's another one. Patient can't afford a crown. So go injection molding. We'll selective etch. We'll paint the universal adhesive on there, evaporate the solvent, flowable bulk fill, and then heated composite bulk fill. Squirt that in there, which I'm telling you, if you haven't ever heated composite, it makes the composite it almost feels like flowable. It squirts in so nice. And because it's transparent, you get a good deep increased depth of cure. And then because it's heated, you'll get an even more depth of cure. So I don't have a fancy composite warmer. I'm not that fancy. I just bought one on Amazon. It was like $40. This is actually it right here. It doesn't have that cool cup of coffee on it with some fancy flour though in the coffee. I don't know how they make that, but I just use this, and you can actually I set it at 155. You can actually set it where you want, what temperature you want it to be at. And then I just put the composites literally like right on it. I don't put it in a cup or anything, and it heats the CompuWall is really nice. The good part about heating composite, obviously, is there's a cool study here at Spear. It said that if moisture infiltrates the resin, it negatively affects the tensile strength, the modulus of elasticity, the flexural strength, and the wear resistance. So basically, moisture getting in the resin is bad. What preheating the composite, it lowers the material's absorption and solubility of the material when compared to the composite at room temperature. So by preheating the composite, you're actually getting a less chance of the moisture to penetrate the resin, which is great. The other part is that it's going to increase the micro hardness. You're going to get a stronger composite, and and more wear resistance because you increase the micro hardness by heating the composite. Same kind of a point made in this article is that the evidence was found that support the hypothesis that preheating can improve the hardness of resin composites. So you're increasing the hardness of the composite. As it all cures, as it gets hard, that top layer becomes nice and strong. So I think with everything on the internet, I think in everything in, whether it's vaccines, whether it's whatever, you can always find the pro and you can find the con. You can find an article that supports something and you can find an article that tears something apart. And so there's articles that say the problem, like what I was just saying about heating composite, is you'll get less shrinkage. Here's one saying that if you heat the composite, you get an increase in shrinkage. But you can always find this is an article saying that preheated composites generated significantly lower shrinkage and that you get a decrease in polymerization-induced shrinkage forces by heating the composite. And heating the composite significantly reduces shrinkage force formation. So like I said, there's pros and cons. You got to figure out what works for you. I do personally feel like when I use my heated composite, on posterior and anterior restorations, that I do get less shrinkage. I feel like it leaves a nice, strong, solid composite. It's increasing the depth of cure because you're heating the composite. So I think there's a lot of benefits to heating composite. Another way to decrease polymerization shrinkage, obviously, is the light. So the light's an important part. So shrinkage to the light, right? So do dental composites always shrink towards the light? It's a good question. And I always kind of thought that in dental school. And now I lean towards is that composite doesn't shrink towards the light. It actually shrinks in the direction of the strongest bond, right? And this is why you see things like this on this class 5. The reason why you see that dark kind of micro leakage happening on that gingival margin right there is because the dentist probably put one bolus of composite. So they probably put one big thing of composite on that class 5 and they shaped it up and it looked perfect and then they cured it. And what probably happened is composite shrinks towards the strongest bond. It doesn't shrink towards the light. So composite doesn't shrink towards the light. It shrinks towards the strongest bond. So as it does, the composite's going to bond it's going to pull to the enamel. That's the strongest bond. And it's going to pull away from that weakest bond, which is, in this situation, is that cervical kind of root exposure. And so you're going to end up with a little micro leakage up there. And I'll show you a way to combat that with class 5. It's a good technique to do that. But that's what's important, is that composites are going to shrink towards the strongest bond. But really the main thing with as we're talking about polymerization shrinkage, is the light. So if we're talking about the polymerization shrinkage and the light, if the light is too intense, that's going to cause some shrinkage too. So finding the right light and how you use the light is important. Some different curing techniques are obviously out there. There's the soft start technique. There's delayed cured and ramp cured and pulse delayed cured. And you could probably find, there'll probably be a rep that can tell you all the different ways you can cure. But I think an important one that I think that works is the one I haven't read down there, is you cure something for 10 seconds at a distance, right? So I don't go straight to the tooth real close right away. You kind of cure at a distance and then give it a little time and then come up and get closer to the tooth. And what you're doing there is you're kind of almost doing like a soft start, where you're just not getting such a strong intensity right away that's going to cause any shrinkage. You're kind of slow starting that composite, which might reduce the stress of the composite, which will ultimately cause less shrinkage. This is Dr. Trost, and she has from Viva Learning, but she talks about doing a directional cure too. And I think that's important to make sure that you've fully cured the composite as well. So it's finding a good technique to cure. So far, before we've getting into the classes, just with polymerization shrinkage, make sure that you're finding ways to decrease shrinkage with your curing light. Make sure you're finding ways to decrease shrinkage, whether you're choosing to heat the composite, and then make sure you're using a good adhesive and a good adhesive protocol. So those are some important things, obviously, to make sure you're cutting down on micro leakage. So this is a screenshot from Facebook. I think just showing how fancy people are getting with these class ones. I mean, that's the secondary anatomy in that thing. Those things are amazing. Those are beautiful. I don't do that. If I put that stain in there, some other dentists will say that's a occlusal cavity and drill it out. But the stamp technique is kind of a cool way to reproduce the anatomy without having to spend a lot of time doing the anatomy. So instead of doing a fancy class one, I'll show you kind of an easy way to simplify the fancy class one, right? So less instruments to no instruments. So patient comes in like this, some occlusal decay. Before you start prepping the tooth, what you're going to do is you're going to take some flowable, squirt on the tooth, and a little micro brush, and then you'll cure it all together. And what you'll get is you'll get this little stamp that shows the anatomy of that tooth. Then you'll do your prep, okay? Then you'll put your composite in there. And I like to use a flowable and a packable. Don't cure the composite. So while the composite's all soft, you'll put some Teflon kind of over it, and then take your stamp and push down on the Teflon. What that's going to do is leave a replica of the anatomy in the composite, peel that off, and there you go. So you go from that to that without having to use any instruments, right? You're not having to spend all that time reproducing that anatomy and pushing composite around. It's an easy way to kind of, again, make the fancy thing simplified, right? So you don't have to do as much work. The problem with class twos is obviously micro leakage, debonding. So let's talk about some of those techniques too. Believe in the bond, right? That's more important than the retention. So make sure you're trusting the bond. And this one, that class one's failing, but it would be better off if it just debonded, because now there's stuff stuck underneath it. So just trust in the bond, right? And this is just showing you don't always have to break contact. Sometimes you'll have more enamel to bond to if you don't break contact. And there's some techniques to do to pre-wedging it and using a diamond strip. That way you're getting a little bit more enamel to bond to in the box when that's possible. But using flowable has a lot of benefits. You get kind of that elastic wall concept. It can take a little bit more of the flexural strength by using a flowable under your composites. And here that's what the snowplow technique is. So the snowplow technique, you're going to cure the adhesive this time. And then it's kind of like an injection mold, except you're curing the adhesive first. You'll stick the flowable in and the packable and kind of press it all in. And you can see the benefit to this is the flowable is going to squeeze in all those gaps. So you're not going to get any holes, and you'll get a nice seal. So the snowplow technique's a nice one. And this shows that, you know, some of the least amount of micro leakage was found when things are done when the flowable and the packable are cured together. And that's the same thing here. You can see little class 2, selective etch it, flowable, packable at the same time. And then you get a nice seal and everything's kind of clean. A modified snowplow is kind of do the same thing. But what you'll do is close the close the distal contact first. So just build up the wall, then snowplow the inside, and then you'll get a nice restoration that way too. This is kind of what I like. As I talked earlier, enamel or composite likes to bond to the strongest bond, right? So the composite's going to pull towards the strongest bond. So in this situation, what I kind of like to do most of the time is I'll build up just the enamel if I can. By building up just the enamel, I'm letting that dentin hybrid layer kind of mature a little bit, and I'm building up just the enamel. And then I'll come back and start building incrementally, because the composite, as you cure it, it's going to cure to the strongest bond. So if you build up the enamel, that's curing, and then you'll kind of build the rest of it up and shape it up, and that's a nice way to get a nice solid restoration too. You just want to reduce shrinkage. Here's a way to just do incremental, same way, some flowable, build up the walls, and then come back and then carve it in. And that was just with flowable, just to kind of see. Some contact class 4s, just because I'll try and go a little quicker here just to get through us, and then we can take some questions at the end. But the thing with class 4 is doing a wax up ahead of time to get a guide made so you can do, or a wax up made so you can make a little Reproseal putty guide to do the lingual. It just takes a lot of time. And so what I'll do is just get a good bevel on there, etch it, Mylar strip, some flowable on the end. There's the Optrasculpt, disc it, shape guard, and polish it up, and you're done. 15-minute quick fix, one composite. Like I said, the key to these are just getting the palatal shelf, right? That's what you can achieve with the Mylar strip and some flowable. Get your contact outline. Once you have those 2 points, then you're just sticking composite on. Class 5s. There's a lot of things with class 5s. Like I said, this is what I was talking about earlier. The weakest bond is what's going to fail. Composite's going to pull towards the strongest bond. It doesn't shrink towards the light. It shrinks towards the strongest bond. So the way to fill this and the way to treat these is to fill that part on the top, layer 1 up there, then layer 2, then do that last little bit. And that's how you'll reduce shrinkage on class 5s. And this study is showing that these highly filled flowables have such a high filler content that they're great to use as just the whole restoration. So you can do a whole class 5 in just flowable. And that's what I'm going to show you here. And the technique is like this. You're going to keep that composite on the enamel, and then the next layer a little bit lower than that. And then what I'm showing here is if you're doing it all in flowable, I think it's best to overbuild it in flowable and then trim it back. So overbuild it in flowable, and Natural Elegance has Henry Schein's flowable is really nice. It even has a little fluoride releasing properties to it. So it's a great flowable for this. But this is how you reduce that shrinkage on near the gum, near the gingival margin is increase, put a little bit of flowable on this part, right up here on the enamel. That part's going to bond to the enamel. Then the second layer is going composite to dentin. So it's going to, and then the last one is here, right? You just don't want the composite to go from dentin and enamel. If composite's touching dentin and enamel and you cure it, it's going to pull towards the enamel, and you're going to get some micro leakage on the weaker bond. So a little bit incremental flowable, and then you get a nice class 5, quick and easy, flowable only. Like, so just real fast, we got 10 minutes. I'll show you some tricks. Here's this one, lingual retainer. Measure it out first with some floss, tie some loops around in there, then etch, bond, put your flowable, then tuck your wire in those loops and just pull it like that. And then I'll cut those little strings and pull them off, and you got a perfect little lingual wire real fast. That's a cool trick. Tooth's got to be moving before you try that, though. Superoxyl is a nice way to help I'll show you. So what happens with these is people use ferric sulfate to stop the bleeding under those veneers, and that ferric sulfate turns things dark. So a good way to stop bleeding without getting those black stains underneath is to use superoxyl. It's going to bubble like that. Then you rinse it off. It'll make the gums look white, but it stops the bleeding, and then the gums will look normal in like 2 minutes. But Teflon tape's a really nice thing. Interproximal strips, make sure you're going in a S shape, not a C shape. If you do that C shape, you're going to wipe away the contact. You're going to get a little space. Make sure you're going S shape, not C shape. I got 10 minutes. I'll go real quick. Let's go for 5 minutes. I'll give you my little philosophy on dentistry, and then I'll do a little Q&A for 5 minutes. We go through a lot as dentists. There's out of 100 patients, 99 think you're awesome. One's going to not like you. Don't worry about that one. Don't let them take up all your thoughts, right? People are spending tons of money to look like this, get no plastic surgery. They're okay looking like that. We do a filling and patients complain that their tooth is sensitive, right? We're a little too hard on ourselves as dentists. This was, you ever get a chance to read something, read Steve Jobs' final words, right? As he talks about how he's accumulated all this money in his life, and toward the end of his life, he's really basically just saying the most important part of life is relationships. Relationships mean more than money. And obviously, a dental bad day, there's a lot of stuff going on in the world, especially right now, Ukraine and stuff. There's bad stuff that happen in dentistry. There's days that go bad, but they're not bad days, right? A dental bad day is not really a bad day. I mean, this is pretty good though. He stayed with it, found the working length, and even though he's not even in there, he stuck to it and sealed it up. But really, a dental bad day is not a bad day, right? So there's a lot of stuff going on in the world. It's not if our work fails, it's when. Stuff's going to go wrong. People get hip replacements every 5 years, and they're fine repaying and getting a whole new hip. We'll do a crown, and if it doesn't last for 20 years, we think it's a failure. You know what I mean? It's like sometimes we beat ourselves up too much, right? It's in medicine, things fail all the time, and people repay for those things. So sometimes life's short, right? Find ways to live it. I was in Toronto giving a lecture. This is that CN Tower. It's like the tallest Western Hemisphere thing. And I read an obituary in Canada. They have these huge obituaries. They're amazing write-ups. And this young 30-year-old mom had died, and she wrote, "It's not the years of your life that matter. It's the life in your years." And it's pretty inspiring stuff. I think you find ways to enjoy life, right? And lastly, it's just a tooth, right? Don't beat yourselves up over this, right? It's just a tooth, not a big deal. But that's my email. Feel free to question or send me anything. But let's do. We got about 5 to 10 minutes here. Let me do some questions real fast. Let's see here. Let me see what I can find for you. Let's see. Cleaning up the composite on the peg lateral case. Would mesial tipping before luge? I'm trying to think of something that I can answer real fast. That's good. Lots of questions in here. Hopefully you guys enjoyed it. It's asking about prep. I try not, if I don't have to reduce the teeth, I won't. Does heated composite have somebody has asked if heated composite will have a detrimental effect on the pulp. I tried to read that too. There aren't significant studies that show that it's detrimental to the tooth. It's not going to cause any necrosis as far as I know. like I said, you can probably find an article that supports that, but I haven't seen post-op sensitivity or nerve damage from using heated composite. Let's see. With flowable and packable curing at one time, what about the depth of cure? Same thing, like the snowplow technique where you're gonna cure the flowable and the packable together. Those ones, I won't do like an injection molding. Injection molding, I'm gonna do a big depth of cure and cure it all at one time. But in a snowplow technique, I'll do a little bit of flowable in the box with some packable, and I'll push that down and cure it. Then I'll do some more flowable and some packable, push that down and cure it. It's almost like an incremental cure with flowable and composite together. Let's see. Are flowable composites weaker in strength-wise when compared to packable composites? So that's a good question. Now, if it's a class 5, there's studies that are showing, and there's research that shows a class 5 you can get away with just using flowable. And flowable now is different than flowable kind of what we thought 10 years ago. There's so much more filler content in the flowable now that you're able to have a stronger composite. And so more filler, less wear. So I think the flowable as a final restoration is something that's coming. I know there's some companies that actually have that right now. That's a flowable higher filler final restoration. Let's see, some other ones I can give you real fast. The flowable brand in this too, like I said, the flowable and the composite that I was showing is all from Henry Schein. That's Natural Elegance by Henry Schein. That's their own brand of composite. Again, I should probably thank them for obviously having me do this webinar, and that those pictures and cases I was showing from my practice are some Henry Schein composites. That's Natural Elegance, the bulk fill, the packable, the flowable, and the flowable bulk fill, all Henry Schein. Let's see. Let's see. And then injection molding, again, like some people are asking, you're going to cure the composite, you're going to cure the adhesive, the flowable, and the composite all together at one time. And so make sure you etch the tooth, rinse the tooth, dry the tooth, and then you'll do adhesive. And if it's a universal adhesive, you're gonna want to air cure just to get rid of evaporate the solvent, and then put your flowable in, your composite, and cure it all at one time. Obviously, if it's a bulk fill, you have an increased depth of cure there because it's a bulk fill. And then if it's a heated bulk fill or a heated composite, that's going to increase your depth of cure more. So heating the composite increases the depth of cure. Yeah, and you can do that same technique for class 2s. Yeah, and I think that pretty much answers all the questions that I can get to. Again, if there's a question that I didn't get, or if you have a question, feel free to email me. Let me know any questions you have or comments or whatnot. But appreciate you logging in. Appreciate you hopping on to listen to this webinar. And again, thanks for joining, and thanks for Henry Schein, and thanks for Viva Learning. Have a good night.